Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the glaucoma treatment? So, in the glaucoma, what are the different treatment modalities that we can use? So, first we will see the medical therapy. In the medical therapy, we have different drugs which can be used. Okay, so we see each group of drugs in detail. So, first we can use beta blockers can be used for the treatment of glaucoma. So in the beta blockers, we can use selective beta blockers like betaxolol can be used, or non-selective beta blockers like temelol can also be used in the beta blockers. These beta blockers will decrease the production of aqueous humor, thus they will decrease the glaucoma. And if you see the side effects of beta blockers, these beta blockers can precipitate the bronchial asthma. They can cause arrhythmias in the patient, and thus they are contraindicated in such situations. They can cause dry eye, and they can also block the nasolacrimal duct. Blockade can occur. So this is about the medical therapy beta blockers.
thank you and thank you for watching.